A very good morning to all of you. Welcome you all in ISFCP dialogue series under the aegis of IQAC-IIC ISFCP, organized by ISF College of Pharmacy and Autonomous College, Moga, Punjab. Today's special guest and speaker, Dr. Rohit Bhatia, Department of Pharmaceutical Chemistry and Analysis, and the title of his talk is Basics for Cracking GPAT and Expert Advice. We welcome you, Dr. Rohit, and you are requested to please proceed further. Sir, please.
Thank you, Dr. Siddharth Mian, sir. So, good morning, one and all present over here. So, the title of my talk is Basics for Cracking GPAT and Expert Advice. Basically, why the word expert is written here, because I have qualified GPAT 4 times and I have gained a lot of things from this GPAT and it has benefited me in several ways. So in the upcoming lecture, I will discuss firstly about the basics of GPAT, how to prepare for GPAT, which books should we refer for GPAT, how to prepare in the last hours, which are the most important topics, and which books should be referred for GPAT. I will also tell you about smaller tricks which you can prepare in your notes for learning the most significant topics. So now starting with my presentation. So GPAT, if we expand it, it stands for Graduate Pharmacy Aptitude Test. So it is a national level entrance exam which is affiliated with the Ministry of Human Resource Development, that is MHRD. So up to 2018, AICT was conducting it every year according to Ministry of Education, Government of India. But nowadays, this test is being conducted by National Testing Agency NTA. The purpose of GPAT examination is it is a national level entrance examination for entry into MPharm programs. So students are benefited financially. They are provided with a scholarship if they qualify GPAT and to pursue MPharm. So who are eligible for GPAT? So the candidates who are having a bachelor's degree in the field of pharmacy, they are eligible to appear in GPAT. Hence, you must have completed 16 years of education, means 10 plus 2, 12 years, and plus 4 years of graduation, that is B.Pharm. The candidates who are in the final year of their undergraduate course, that is B Pharmacy, they can also appear for the GPAT exam. It is not compulsory that there is some kind of requirement of B.Pharm degree. If somebody is in the 8th semester or 7th semester last month, they can also apply for GPAT. So the modes of counseling are online as well as offline. So applications fee for general category is 2000 rupees and for reserve categories it is less than 2000. Frequency of conduct is once an year, and GPAT validity is for 3 years. Nowadays I think the validity has been increased, but not officially it has been decreased. So as I will get the information about the validity, I will share it to you. The GPAT score is accepted by all AICT approved institutions, university departments, constituent colleges, affiliated colleges, a few scholarships, and other financial assistance in the field of pharmacy are also given on the basis of the GPAT score. So per year there are approximately 39,900 candidates who are appearing in GPAT examination seeking admission to MPharm, and about 841 pharmacy colleges and universities are participating in it. GPAT exam is conducted in the month of January, February, April, and this year it has been conducted in the month of May. So GPAT exam format and pattern. So if we talk about the pattern, GPAT test contains total 125 multiple choice questions, each right answer having 4 marks. Total there are 500 marks. Time limit is 3 hours, that is 180 minutes. Negative marking is there, 1 mark for each wrong answer and -1 for each wrong answer. No negative marking is there if the question is not attempted by the candidate. Strategy for qualifying GPAT. So to qualify GPAT, it is enough to attempt 80 to 90 MCQs. So if we see the last 5-year average cutoff, it was 170 for unreserved category, 170 to 190 out of 500, and for SC and ST it was 90 to 100 marks out of 500. In the year 2021, cutoff to qualify GPAT exam for unreserved was 186 marks, for OBC it was 131, and for SC and ST it was 103 and 76. In the recent years, 2022, the cutoff was 148 marks out of 500 for general category. For OBC, it was 120. For SC, it was 94. And for ST, it was 75. And a new category was incorporated, that was economically weaker section, that was EWS, and the cutoff for it was 122. So if you attempt 90 MCQs from that around, if you attempt 90 MCQs and you are attempting 60 MCQs exactly right and around 30 MCQs wrong, your score will be about 210 out of 500. So you can secure a good rank if you score 210. If you attempt 80 MCQs from that around 50 MCQs right and around 30 MCQs wrong, your score will be 170 out of 500. So here also a good chance of qualifying the GPAT exam. Above 170 is the safe score to qualify GPAT, but try to score above 200 for higher All India rank. सो ना कभी भागें और ना कभी रुकें, बस हमेशा चलते रहें, यही एक विद्यार्थी की सफलता का मूल मंत्र है. तो आपको प्रॉपरली चलते रहना है, एक शेड्यूल बनाना है, उसी शेड्यूल के अकॉर्डिंग आपको जीपैट की प्रिपरेशन करते रहना है बिना रुके. सो आफ्टर क्रैकिंग जीपैट एग्जामिनेशन, what benefits you will get? So firstly, you will get tag of pharmacy expert. The vision of people will be different for you. They will see you as a pharmacy expert. Beyond this, AICT New Delhi will provide a scholarship of 12,400 per month to all GPAT qualified students, and in future this amount may be increased. You are eligible to get admission in best pharmacy colleges in India in master courses, that is M.Pharm and Pharm MBA. Some MNCs also prefer GPAT qualified students to provide job opportunity. Academic institutions mostly prefer GPAT qualified staff and they give them handsome salary. Many university has exemption for GPAT qualified exams to be registered for PhD. There are so many universities. If you are having a valid GPAT card, valid GPAT qualified card, then you do not have to appear in the PhD entrance examination. You can directly appear in the interview for admission inside the PhD. सो आपने शुरू करने की हिम्मत है तो आप में सफल होने की भी हिम्मत है. अगर आपके माइंड में विजन है कि मुझे जीपैट क्वालिफाई करना है और आप उसके लिए अपनी प्रिपरेशन शुरू करते हो, तो निश्चित रूप से आप सफल होने की भी कैपेबिलिटी उसमें रखते हैं. सो नाउ द थिंग्स आर हाउ टू स्टार्ट, व्हाट टू रेफर एंड व्हाट पॉइंट्स टू कवर. What is more important and how to prepare. These are the most important things which comes in the mind of a student when he or she starts for preparing for GPAT. So along with other requirements are which books should be referred to study these subjects for GPAT, what are the contents, how to start, from where to start, which subjects are more important, which topics are more important. So this should be the vision of a candidate prior to starting for GPAT preparation. So along with this, if you are a pharmacy student, if you have done a 4-year degree, so you must aware about these questions. What is solubility? What is dissolution? When the published, when the IP was published, when the other international pharmacopoeias were published, how many total editions of Indian pharmacopoeia are there? According to Indian Pharmacopoeia 96, what should be the temperature range? What is primary emulsion? What is pH? Which type of drugs are available in the market? Mostly drugs available in the market follow which order of reaction? How many number of half-life are required for a drug absorbed and elimination from the body? Which types of drug are absorbed in our body? How many total numbers of members are there in PCI? Total numbers of N in SPC, total numbers of in DTAB, how many years for patent grant, how many years for copyright grant. So these are very basic questions, and you are directly getting 2 or 3 questions from this basic information. So everybody should know at least these basics. So there are some tricks which the students can prepare for themselves. Suppose taking an example for general test for alkaloids. For this, you can prepare a simple trick like MD, WHO, and PTO. So MD, in MD, M stands for Mayer's reagent, D stands for Dragendorf reagent, W stands for Wagner reagents, H stands for Hager reagents, P stands for picric acid reagent, and so many other tricks you can prepare to understand or to remember the basic tests for some important topics or some cognosy topics. Likewise, for indole alkaloids, you can remember V Niper. For isoquinoline alkaloids, you can remember OHCBI. So it is not compulsory that these exactly similar abbreviations should be there. You can prepare your own abbreviations, your own short tricks, which can be pointed out directly in your mind. So GPAT and NIPER preparation plan. So when you start preparation of GPAT and NIPER, firstly you give the importance to the GPAT. If you are able to qualify GPAT, then you are definitely able to fight for NIPER, and you are definitely able to qualify NIPER. When compared to NIPER, in which consistent only the basic of subjects, especially in organic and stereochemistry and analytical chemistry. So when you qualified in GPAT, then only you will be eligible for NIPER. So firstly focus for GPAT. सो हमारा भविष्य हमारे वर्तमान पर निर्भर होता है, इसलिए अपने लक्ष्य पर काम करो. तो आपका प्राइमरी लक्ष्य जो है वो जीपैट होना चाहिए, नाइपर अपने आप ही कवर हो जाएगा. So how to start? So firstly divide all subjects from simple to difficult according to their weightage in entrance exam. Basic knowledge of pharmacy will make it easier to crack GPAT. So if I talk about the GPAT exam, there is nothing from outside. If you are having a good conceptual knowledge of all the subjects which have studied from first semester to 8th semester, you are definitely able to qualify the GPAT exam, because nothing is asked beyond the syllabus, nothing is asked beyond your level. So only the subjects are focused which you have studied from first semester to the 8th semester. So according to my opinion, I will give an idea. Firstly, how to start with the, so order of my preference should be firstly pharmacology, then take pharmaceutics, then take pharmacognosy, then take pharmaceutical chemistry, and ultimately you can take rest of the subjects. So if we talk about the pharmacology, what should be learned, or what are the important topics? So here the classification of drugs, class of drugs, mechanism of action of drug, major adverse drug reaction associated with the different classes of drugs, major pharmacological uses of the drugs, various syndromes associated with the drugs, antidotes for proper drugs, and drug-drug interactions. So important topics in pharmacology are general pharmacology, autonomic nervous system, central nervous system, cardiovascular system, diuretics, endocrine system, various neurotransmitters, chemotherapy, and anti-cancer drugs. So in pharmaceutics, so pharmaceutics is widely distributed into several sub-branches like dispensing pharmacy, physical pharmacy, industrial pharmacy, and jurisprudence. So dispensing pharmacy, here you will definitely get question from these topics like Latin terms, allegation method, proof spread method, dose calculation formulas for child, posology, and incompatibility. From physical pharmacy, you will definitely get questions from chemical kinetics, rheology, colloids, suspension, and emulsion. In industrial pharmacy, you must cram tablets, capsule, aerosols, microencapsulation techniques, and parenteral preparations. From jurisprudence subject, you have to learn schedules because definitely you will get question one or two from schedules, various acts, laboratory locations, form numbers, members in PCI, SPC, and DTAB. Then from pharmacognosy, you should go for classification of drugs, chemical class of drugs like indole alkaloids, isoquinoline alkaloids, general tests for identification of alkaloids, individual drug tests like ergot, Van Erg test is for ergot alkaloids, major chemical constituents of crude drugs, major uses of drugs like ergot alkaloids, major production areas or factories like where is the opium factory situated, biological source and family. So important topics in pharmacology are alkaloids, glycosides, volatile oils, tannins and resins, terpenoids, carbohydrate drugs, and all biosynthetic pathways. In pharmaceutical chemistry, you should go for organic chemistry. So in organic chemistry, if you are not well familiar with organic chemistry, so among organic chemistry, just focus on these topics like SN1 and SN2 reactions, E1 and E2 reactions, stereochemistry, and all kind of naming reactions. In analysis, focus on the titrations, all chromatographic techniques, redox reactions, non-aqueous titrations, complexometry, Mohr's method, Wohlhard's method, and Fazan methods. In spectroscopy, all the spectroscopy should be known to you, their principles, their working, their instrumentation, like UV visible spectroscopy, IR spectroscopy, NMR spectroscopy, mass spectrometry, atomic absorption spectroscopy, flame photometry, turbidimetry, nephelometry, fluorimetry, etc. So, what are the most important subjects and their books? So, for dispensing pharmacy, you can refer simply R.M. Mehta. For jurisprudence, go for N.K. Jain. For physical pharmacy, go for C.V.S. Subramaniam book. For industrial pharmacy, go for Lekman. For biopharmaceutics, go for Brahmankar. For microbiology, go for Dr. Kontal Das. For pharmaceutical engineering, refer C.V.S. Subramaniam. For pharmacognosy, Dr. C.K. Kokate book is enough. For pharmacology, K.D. Tripathi is enough. For organic chemistry, Morrison Boyd or Behl and Behl is enough. For pharmaceutical analysis, Y.R. Sharma, Pavia, Gary D. Christian, they are sufficient. For physical chemistry, Behl and Behl. Inorganic chemistry, G.R. Chatwal. For medicinal chemistry, V.K. Kapoor, Foy or Elgar Sami. For biochemistry, U. Satyanarayana. For biotechnology, S. Chand. These are sufficient and will give you complete knowledge about the subject. So this is the table which you should know the main drugs and their associated side effects. Like ACE inhibitors, they are associated with dry cough, chloramphenicol associated with grave baby syndrome, chloroquine that is associated with phototoxicity. Likewise, all are there. There are some animals which are used for bioassay like digitalis, they require pigeon, glycogen, they require cat, for atropine, rabbit is required, for insulin injection, guinea pigs are required. So these must be known to you. you can get a direct question from these topics. So these are some emulsion requirements. What should be the ratio of oil is to water is to gum? What should be the ratio of these pans, sorbitols, 2 in 20, 2 in 80, etc. These should be known to you. This is very important slide. You must know the locations of various laboratories and drug testing labs. Like BCG vaccine lab is situated in Chennai. Central Drug Testing Lab is situated in Mumbai. Central Drug Laboratory is situated in Kolkata. Central Drug Research Institute located in Lucknow. Central Research Institute in Kasauli. Indian Drug Manufacturers Association in Mumbai, Indian Society of Blood Transfusion and Immunohematology in Pune, Indian Veterinary Research Institute, Izatnagar, Central Indian Pharmacopoeia Laboratory in Ghaziabad. So make a routine and do each subject every day. Never do one subject whole day. Don't take one subject each day. Divide your schedule into smaller parts. Never rush and never try to finish it quickly. Go deeply. Also start solving at least 30 questions per day. It will help you to evaluate yourself. Last month, 1 month, you do not need to revise, you do not need to take new topics. Just revise the previous syllabus carefully. Okay. So remember not to study anything new in last 15 days. Just revise all you have studied and focus on yourself. So this is the pattern. Pharmaceutical chemistry, generally 38 questions may be there of 152 marks. Pharmaceutics, equal weightage 38, 152 marks. Pharmacognosy, 10 questions for 40 marks. Pharmacology, 28 questions for 112 marks. Other subjects, 11 questions, 44 marks. So always remember, always take care of these things: your performance, persistence, discipline, attitude, learning from failures, hard work, taking risks, determination of your goal, excel, keeping patience, and ultimately all these things will lead to success. सो जिंदगी में किसी से भी अपनी तुलना मत करो. जैसे चांद और सूरज की तुलना किसी से नहीं की जा सकती, क्योंकि वो अपने समय पर ही चमकते हैं. सिमिलरली यू आर यूनिक. ट्रस्ट इन योर सेल्फ. You are able to get succeed by your own self.
Thank you, Dr. Rohit. I request to Dr. Rohit, please.
Thank you, sir.
Yes. Thank you, Dr. Rohit, for this wonderful talk regarding the GPAT and its preparation. We are very thankful to his wonderful talk and guidance to all pharma graduate students and postgraduate students. And students, if you have any query, please inbox your query in our YouTube inbox, chat box also, and please visit our website www.isfcp.org. We again thanks to Dr. Rohit and all listeners. Thank you so much.
You are welcome, sir. Thanks for providing me the opportunity. If students, you are having any query, so you can post your comments here and I will try to resolve them. Thank you.